Today I'm here at Nabaclis Health Center, which is located on the east coast of Demerara, where the Ministry of Health is hosting a one-day dental outreach. Some of the services you will hear from Minister and also the doctors and some of the other persons that played a part to help make this outreach possible today.
Hi, good morning. I'm Dr. Monize. I'm the Principal Dental Surgeon at the Ministry of Health. Today we're at C.C. Nicholson, that's in Nabaclis, and we're having one of many of our dental outreaches. Today we're hoping to see approximately about 150 patients, and we are offering a variety of services. We're offering extractions, examination, fluoridation, some fill-ins, and even complex extractions as well. Like I said, we're just hoping to achieve about 150 extractions, and this is one of many outreaches across the country. Last month we were in Victoria. This month we're in the Nabaclis. Next month we're going to be in more likely Ants Grove, and we're going to see about 200 persons there.
Hi, I'm Talisha Cully. I'm from the community of Nabaclis. We're here at the Dr. C.C. Nicholson Hospital for the dental outreach. First, we'd like to thank the minister and the dental team for this outreach because we're grateful. I mean, services are held in town and so forth, but bringing it to the community, we feel great. We feel remembered that, we're having this here today. So we're getting persons from the age of 4 to 80. We had an 80-year-old this morning, and she was doing cleaning, and she wanted to do the fill-in, but they advised her the best way and so forth, even on to the kids before they go off to school.
Good morning. My name is Juanita France Beniston. I am the manager for care centers in Guyana. I am also the counselor for, part of the village council for Golden Grove. And we're happy that we're able to have this outreach today. We're able to bring services to our community so that persons who are not able to go to Georgetown can benefit from the services right here in the community. And in addition to bringing the service, they're also being edified because most persons did not know that we have the service existing at President's College. So when they leave here today, they can share that information and have other residents access what they didn't get to access today.
Introduce yourself.
I am Dr. Marisha Yerrick. I am the doctor in charge here at Dr. C.C. Nicholson Hospital for the last 3 years. We are very grateful to have had our dental team visit our institution. Generally, when we have patients that require any dental assessment or so, we'll have to send them to town. So this outreach here today is really much appreciative, and I'm sure that the people from the community will benefit a lot from this initiative. Thank you very much.
So today we are here in Nabaclis, and I think we've had so far an extremely good turnout. We had more than 100 persons who have been at this facility today. So the team from the dental school, they're going to work to ensure that everybody who came out can get, their tooth taken care of. I think they're doing here some fillings, they're doing extractions if it's absolutely necessary. But this is a program that we want to really continue across, not just on the East Coast, but in different parts of Guyana. Just recently, we were able to put in a permanent dental area at the Mahaika Health Center. So now persons living from Cane Grove, Mahaika, Unity, those areas, they can now go to Mahaika and get dental work done there. And similarly, on the East Coast, where there are gaps in our service, we want to make sure that we come and do these types of clinic so we can fill those gaps. So I think all in all, it's a very good initiative, and I want to commend the dental school for coming out and doing this type of initiative, and in collaboration with the local community as well, because the local community would have identified this as a need, and we have been partnering and working with them so that they can spread the message in the village and get people to come out, and so we can provide this service. Well, the only reason we can't offer it every day here is because we don't have enough dentists. But what we want to do is to put people strategically at different points on the East Coast. So if anybody got a dental emergency or want to come in to do prophylactic kind of dentistry, they can come to those specific sites. But these types of outreaches, we'll try to do them as often as possible so that we can help people in the various villages. What you would notice is that over, I would say, the last 3 years, we have put in more dental units across the country. We have more dentists now in different regions of Guyana. So in almost every region now we have a dental presence, and we are increasing that footprint with more dental units on the ground, and we're placing them strategically. So we now have, I think, quite a number of units now in Region 6, in Regions 5, Regions 4 here, 3, 2, 10. So we're increasing it. I was on a recent visit in 10, and we have given them $100 million, and they're taking some of that money to do expansion of the dental services there. So, different regions are operating differently, but one of the need we surely recognize is that there's a need for dentistry across the country, and we want to make sure that people can access these services readily, and of course the service that we provide is free. We have a program where we trained at the Cheddie Jagan Dental School. We train dentexes and dental technicians. We also have at the school itself a collaboration with the University of Guyana where dentists are being trained. So this is an ongoing program. We normally would get maybe about 10 dentists per year, about 10, and dentex is maybe a similar amount or a little bit more. But all these persons, once they complete their training, we integrate them in the ministry, and then we like to send people out into the region. Not everybody should stay in Georgetown. We want more people to go out in the region. So when we are recruiting people for these programs too, we try to recruit from the region. So when we notice that a particular region, they don't have a lot of dentists or dentexes, we go to that region and actively recruit people who meet the qualifications, bring them in the program, and after their training, we send them back to their home region. So by doing that, we think that we'll have a more sustainable program.